People are wondering when this is actually going to happen. The first jab, we saw it on the news in other countries. The 29th of December is when Europe, the latest date that Europe may give the green light to it. It could happen sooner. Stephen Donnelly has said during the week here on Newstalk Breakfast that perhaps we'll be looking at mere days after we get the green light to the first injection. Is that your understanding too and your belief?
Yeah, again, if all of the issues that we know, there are still so many issues that we don't know. But assuming the 29th is a decision, and that's still a work in progress, we are mobilised now as part of all of this to be prepared, to be ready.
So the first week in January, most likely, and I know you can't commit to that because there are a few uncertainties, but that's the kind of timescale we're looking at.
Well, I've always said it certainly should be in early in January. We're mobilising and delivering a vaccine. And again, the first unknown right now is the volume of delivery of the first batch and the date of delivery of the first batch. But that again is part of what the task force will be.
Healthcare workers, we all understand why they're in the first tranche of people who will be vaccinated. The front line cannot fall. Will this vaccine be mandatory for healthcare workers?
Well, a few things. First of all, I'm always a firm believer, and WHO are very strong on this. Everything about this pandemic is about winning hearts and minds and not forcing compliance. I think that's what proved very beneficial for Ireland so far in our success. And that goes for healthcare workers too. If we look at what's happened in the flu vaccine this year, we took a different approach. We took a risk-based assessment. So for each medical clinical manager, they addressed the workforce and took an approach around risk-based. So in other words, the risk is you need to get the vaccine rather than deploying legislation. Now, one issue about making things mandatory is that it can actually backfire against you. You actually start to feed a lot of the anti-vaccine campaign. So the WHO has been very clear on this.
You would hope though, Paul, that there wouldn't be anti-vaxxers working as healthcare workers, wouldn't you?
But it doesn't stop the overall campaign. It's not the healthcare workers themselves. And what we've seen this year, very briefly, in terms of the flu vaccine, I mean, 2 years ago we were about 40% of healthcare workers taking it up. Last year it was just about 60%. We don't have the final figures for this year, but we have seen a huge extra demand and take up from healthcare workers. And I do expect, and there is no rationale that healthcare workers should not get this vaccine.